Hello YouTube and welcome back to the channel. In today's video I'm going to do phase 4 of my knee rehabilitation which was aimed at rehabilitating the medial meniscus in my left knee. I heard it during the summer. I had to take a couple of weeks where I had a downside in training, and then over the last 4 or 5 weeks I've just been building back up my training, and in the process of doing that I've been doing some very specific strength and conditioning exercises to mainly to give me confidence to use that knee again, to bring it through its full function and enable me to get back to the running distances that I want to do. Last week I got to about 52 kilometers I think of running in total, and this week I should be up around that 60, 65, maybe even 70k at the end of this week. There still is a little bit of pain with the knee, a very small amount, but overall the knee has been fully rehabbed, and these were the 4 exercises that I was doing over the last week in phase 4 to bring me just to that final level where I just get that maximum amount of confidence. So the first exercise in phase 4 is what I call a sumo squat. So bring the legs out, turn the feet are just turned out at a slight angle, just going slightly out to the side. Keep the elbows in by your side, and what we're going to do is we're going to drop it down into a deep enough squat, right down and back up, deep breath in and breathe out. So this is really stressing the medial aspect of that knee joint. So like I said in the earlier videos, if you don't feel up to doing this yet, or there's still quite a bit of pain in that knee, you don't have the confidence to go down as deep as I am, trying to get my elbows down to my knees. If you don't feel that you have that confidence yet, then I would say stick at phase 3 for another week. Deep breath in, breathe out. In. Last one. And relax. From there, I'm going to start on the good leg, and I'm just going to do those little hops again, the pogo hops. So I'm going to do 10 on the right leg, 10 on the left and symptomatic leg, and then I'm going to do 10 alternating. So hands and hips, or you can use it arms to keep your balance, whichever you feel is more comfortable. Good. Straightforward on the good leg. So now onto the bad leg, or the symptomatic leg. So hold it there. Good. Now from there, what I'm going to do is I'm just going to go side to side. So I'm going to start on the left, on the symptomatic leg, but I'm going to hop across onto the non-symptomatic leg, and then just continue for 10 reps. So it's just bring the leg up, and it's just over. Let's do one more on each leg. 11 and 12. Good. From here, third exercise, I'm just going to down into a lateral lunge. Just drop it down and across. So again, really stressing the medial and the lateral aspect of that knee as you come in and out of that exercise. Again, I don't have any pain. There's a little bit of a strain as I go down when I go that way, and the strain is right in that medial side, but it's not really any pain. And as I do more and more of these, that strain is gone now. So it's probably just a little bit of tension around the joint because I haven't been using it in this sort of a plane too much over the last 3 phases that I've done up until now. Last one on each side. Good. From there, the fourth and final exercise is just a weighted 1 leg deadlift. So I'm going to start off on the good leg. I'm just going to drop it down and up. Trying to keep the leg relatively straight as we go down. Don't bend the knee too much. Right down, breathe out. 8, 10, 2 more. Last one. Good. So good confidence in that good strong leg. Now we're on to the symptomatic leg. This should again feel totally fine. From there, I'm just going to lift up the right leg, drop it down. So I almost keep that knee fully straight as I go down. Deep breath in. Seven. Good. Right down. Deep breath in. Breathe out. 8, 9, 10. 2 more. 12. Good. So that's it with those exercises. I'm going to go around and do a second set. I might even do a third. I've done those 3 days already this week. I've done 2 sets on each, but today I might bring it up to a third set. I'm feeling very confident, and like I said, there's almost no pain in that knee at all. So that's it. That's the 4 exercises in phase 4. Those exercises are obviously a lot more dynamic and a good bit more difficult than phase 1. Phase 1 was fairly easy. It was a lot of kind of static holds. Phase 2 was a little bit more dynamic than that. Phase 3 brought on a bit more, and now this is phase 4. Pretty much those 4 exercises bring my knee through the maximum amount of rigor that I would need in order to carry me across running on some sort of flat terrain. Very confident doing them, no pain doing those exercises at all, so overall very good. I hope you enjoyed this series, guys. If you're just seeing this video now, don't forget to watch phase 1, 2 and 3, and if you follow those 4 phases pretty much maybe a week, or like I said in one of the videos, sometimes if you're not confident enough at the end of the week of whatever phase you're in, you can always just do it for a second week. But overall, if you follow those 4 phases, do it strictly like what I said, keep your running going, you should be able to rehabilitate any sort of meniscal knee tear. Remember guys, run far, run fast, but most of all, run sensible.